It's time for our health report, and joining us now is Africa 54 health correspondent Lino Mudu with the latest news on the harmful effects of tobacco. Lino?
And that's right, Esther. The World Health Organization says tobacco kills 8 million people each year, and it also says e-cigarettes are not a proven alternative. Cigarette smoking is often a hard habit to break. According to the World Health Organization, there are around 1.1 billion smokers worldwide. But health experts say cigarette smoking harms nearly every organ of the body. Dr. Vinayak Prasad is director of the WHO Department for the Prevention of Non-Communicable Diseases.
So every year we know about 8 million people die from tobacco. That's the global figure, about 8 million. About 1 million of them die from secondhand smoke. Now, these figures have stayed constant for the last couple of years.
Dr. Prasad says 40% of tobacco victims die from lung diseases, including cancers and chronic respiratory diseases, about 1 million from secondhand smoke. Children are also affected significantly. More than 60,000 children around the world under age 5 die of lower respiratory infections caused by secondhand smoke. Dr. Prasad says e-cigarettes also pose a serious concern, dispelling the belief that they are less harmful.
So these products are not smokeless. These products are tobacco products. So there are two big things. One is these are tobacco products, and our recommendation as WHO is please regulate them as tobacco products. The claims that these are less harmful, we don't know.
Dr. Prasad warns that e-cigarettes appear to normalize smoking and hooks young people.
On the contrary, we are seeing that in countries that have been very liberal with electronic cigarettes, the use of ends is very common amongst youth, actually more than 2 times what conventional cigarettes is. So basically there's a perception that these are safe products, and it's actually hitting the market, and the group which is most vulnerable, children, teenage children. So it's a problem which we are seeing in a number of countries now.
The WHO recommends that e-cigarettes be subjected to the same guidelines as for tobacco products. Non-smokers should be protected from secondhand smoke, pregnant women should be prohibited from using them, and advertising content must be regulated. Observers say anti-tobacco campaigns and measures are bearing fruit, but mostly in high-income countries. On the other hand, the smoking population remains constant or even increases in low-income countries, where the tobacco industry is now focusing its sales efforts. And World No Tobacco Day is observed each year on May 31st to encourage abstinence from all forms of tobacco consumption. The focus of this year's No Tobacco Day 2019 is on tobacco and lung health. The campaign aims to increase awareness on the negative impact that tobacco has on people's lung health, from cancer to chronic respiratory disease, and the fundamental role lungs play for the health and well-being of all people. The campaign also serves as a call to action, advocating for effective policies to reduce tobacco consumption and to engage stakeholders across multiple sectors in the fight for tobacco control. Joining me now is Bintou Camara Bitieki, Regional Director of Africa Programs for the Campaign for Tobacco-Free Kids. It's an advocacy organization that aims to reduce tobacco use and its deadly consequences in the United States and around the world. Mrs. Bitieki, thank you so much for joining us.
Thank you so much for having me, Leonard.
So what is your take on where we stand in the global fight against tobacco, particularly in Africa?
Well, on the global level, tobacco use rates have declined thanks to many countries that have adopted and are implementing strong tobacco control policies. So that's on the global level. Unfortunately, our story in Africa is a little bit different. So tobacco companies have for a long time now set their eyes on the African continent. Mm-hmm. And that's mainly for several reasons. One, we have more flexible practices on the continent and fewer restrictions that allow them to take advantage of and market their lethal products in Africa. Secondly, while the tobacco use rates have remained in the single digits compared to the rest of the world. Those rates are bound to increase.
Okay. And let me talk about the fact that your organization is focusing on children. Why is it important to focus on this population, children and kids and youth in general?
It's very important because kids is our future. So we're talking about protecting a population that's going to represent probably the future smokers of tomorrow. So our youth of today is the tobacco companies as replacement smokers of tomorrow. So we need to educate them as much as possible so that we can prevent hopefully the nearly 8 million deaths related to tobacco use that Dr. Prasad from the WHO was just citing.
So what is the priority when we talk about tobacco control, especially talking about the youth? Are we trying to prevent new smokers or help those who are already smoking, help them quit?
Yeah, I think both populations are equally important. If a country implements the strong tobacco control policies that the World Health Organization Framework Convention on Tobacco Control requires, those policies will unequivocally not only cater and help with encouraging non-smokers to not pick up the habit and current smokers to quit. Perfect example of doing that is by putting graphic health warning, large graphic health warning on tobacco products, because the jarring images can deteriorate the envy or just tell users and non-users to either not start or to quit.
Mrs. Bicheki, we have to leave it there. Thank you so much for joining us.
You're welcome. Thank you so much.
And Bintou Camara Bicheki is the Director of Africa Programs for the Campaign for Tobacco-Free Kids. And that's our health report for today. To stay in touch, find me on Twitter @LenorMoudou. Esther, back to you.